Hello, everyone. Welcome into the Road Safety Capacity Building Program, first webinar on road safety management. Just going to wait another 1 or 2 minutes to allow people to enter the platform, and we will commence shortly. Thank you.
Добрый день, рад вас приветствовать на этом вебинаре. Хотели просто сообщить, что буквально через пару минут мы начнем.
Okay, good morning, good afternoon, good evening, depending on where you are through our fantastic region. My name is Blaise Murfitt, and I want to give you a warm welcome to this, the Road Safety Capacity Building Program, the first webinar focusing on road safety management.
Уважаемые участники, добрый день, доброе утро, в зависимости от того, где вы находитесь на территории нашего фантастического региона. Я хотел вас поприветствовать на первом из серии наших вебинаров, посвященных безопасности дорожного движения и повышению потенциала.
I want to commence today with a very short announcement regarding our Russian language interpretation, which is that unfortunately, due to a technical issue for just today's webinar, we will not have the Russian language channel available.
И хотел начать с краткого объявления касательно перевода на русский язык. К сожалению, в силу сложившихся обстоятельств из-за технических неполадок, сегодняшний вебинар не будет доступен в условиях синхронного перевода. То есть мы не сможем сегодня осуществлять перевод на русский язык.
However, we will be working to create a version of today's webinar in Russian language to send to all of our Russian language participants of today's webinar, so you will not miss out. And we will also be working to ensure that for the next webinar on Thursday, we will have the interpretation service available.
Тем не менее, мы постараемся сделать сегодня по завершении этого вебинара, мы постараемся подготовить перевод этого вебинара на русский язык, для того, чтобы у русскоязычных участников была возможность ознакомиться с его содержанием. Как можно скорее мы это сделаем и предоставим ссылку на запись этого вебинара на русском языке. И также мы постараемся как можно скорее решить проблему с этой технической неполадкой, для того, чтобы в четверг функция синхронного перевода на вебинаре была уже доступна.
Okay, so thank you, Rustam, for that. And again, apologies for the fact of a technical issue today. So with that, I want to now formally commence today's proceedings and again, give you a warm welcome. As I mentioned, my name is Blaise Murfitt and I'll be moderating these sessions for this particular module and with the Global Road Safety Partnership, and which you'll hear about a little more in a moment, and also providing support to the Asia Pacific Road Safety Observatory in partnership with the Asian Development Bank and the International Road Assessment Program, all the organizations that are bringing you this course, which we are thrilled to do so. So you'll be able to see there on your screen just a brief overview of this particular module of the course, where we are focusing on that first key pillar of road safety, which is road safety management. So you'll see that today we'll be hearing from representatives from ADB and also GRSP. Then on Thursday, we'll move into sessions focusing on road safety lead agencies and strategies with a speaker, Samantha Cofield, who's the head of road safety at the Transport Accident Commission in Victoria, Australia. We'll also be having a session focusing on data and technology in relation to road safety management from TRL, which is a UK-based organisation who work in road safety right throughout the world. And then we'll be moving through to a very practical training session on Monday, the 19th of July, where we will take you through a number of different activities where you will get the opportunity to actually practice and learn key strategies and approaches to both integrating road safety management into your road safety projects, but also how to actually focus on those key skills in the road safety work that you do in your country or city. So that will be the session on the 19th of July, which will be led by Dr. Judy Flyder from GRSP, who you'll hear from in a moment, and Samantha Cofield from TAC. They will also be introducing you to our homework assignment, which again is designed to help encourage you to think through how to utilize road safety management to address road traffic, serious injuries and deaths. So that will run from the July 19th to July 28th in your own time. And then we'll finish this particular module on the 5th of August with an opportunity for you to hear back from Judy and Samantha about your assignments, to get really detailed feedback and to talk through some of those key kind of findings and key challenges that were present during that homework assignment. And we will also hear from colleagues at ADB of a really good case study of the type of thing that we'll be learning through this module in action, which is road safety management being put into action in one of the countries in our region. So that is just a brief overview of this particular module. This is the first of 3 modules of this course, so we'll be following up with another module later in the year focusing on safer road users, and then early next year looking at road infrastructure. But this key first one focusing on road safety management. Next slide, please, Michelle. Okay, so we would absolutely love and actively encourage your active participation in this particular course. We really see this as an opportunity for us to both share experience and knowledge from key partners around the world, but also to hear about the challenges or indeed the wins from your particular countries, and see how these concepts match into your particular place. So please feel free to write any questions or comments using the Q&A box at the bottom of your screen. That's where you'll be able to put all your questions and comments, and then we'll try to bring up as many of them as possible, both through the session itself, but also in a formal Q&A at the end of the session. But please don't wait till the end of the session to type it in. The moment a thought or a question comes to mind, put it in that Q&A, and we will log that, and we'll also ensure to try and raise it with our presenters. And I really do warmly encourage you to do so, and just think of this as a great opportunity to test out some of the problems you might be having in your country or city or state, and have this opportunity to ask our experts about how the knowledge they have might be able to help the work that you are doing. Of course, you can also use the Q&A box for any questions you might have of a technical nature in relation to this platform, or any issues you might be having with the Zoom. So please also use the Q&A function. So again, the Q&A function will be your opportunity to engage with us. So please put anything and everything you would like into that Q&A. Next slide, please, Michelle. So I've just talked before about this particular module and the key elements, which are those webinars and the homework assignment. So upon completion of all of those, you will be able to receive a certificate of attendance, which will be issued to participants who've completed all of those requirements. And we'll also be linking to the presentations will be shared with all the participants as well. We want you to have this information to help your ongoing work, not as a one-off. And like I mentioned earlier, for our Russian participants, particularly for today's session, we'll be making available an audio version or a written version of this. We will also be utilizing some polls during these webinars. I am sure probably many of you have seen these now already, but this will be something that pops up on your screen. And please do click and answer when that's done. So this is not going to be graded or in any way, and that's the same with your homework assignment. This is really just for us to understand your knowledge and hopefully also get some interaction during this particular course. Next slide, please, Michelle. Okay, so I want to hand over in just a moment to our first speaker, but in case other people joined a little late, I just wanted to make one more mention of the issue just for today in relation to our translation. So Rustam, I'm going to talk through it one more time. So a reminder again that unfortunately for today, our interpretation service on Zoom is not working. We will, however, make available to our Russian-speaking participants some type of recording or transcript of this particular session so that you will not miss out. And we will ensure that for Thursday's session, we will have the system up and running so that you will be able to follow along with the translation in that particular session.
Уважаемые участники, хотели просто еще раз напомнить русскоговорящим представителям о том, что сегодня мы хотели принести извинения за то, что у нас возникли неполадки с функцией перевода синхронного на русский язык, и также мы постараемся как можно быстрее сделать так, чтобы перевод сегодняшнего вебинара либо в видеозаписи, либо в виде транскрипции на русский язык был готов как можно скорее. Мы вам его передадим. И также мы постараемся приложить максимальные усилия для того, чтобы наш вебинар в четверг прошел уже с функцией синхронного перевода. Спасибо.
Thank you, Rustam. So with that, I'm going to introduce our first speaker of this Road Safety Capacity Building Program. As I mentioned at the top, this is a program that is run through the Asia Pacific Road Safety Observatory. Is sponsored by the Asian Development Bank, Global Road Safety Partnership, and the International Road Assessment Program, with support from the World Bank, GRSF, and UKAID, as well as ADB. So with that, then our first speaker to provide some welcome remarks is Jamie Leather, who's the Chief of the Transport Sector Group at the Asian Development Bank. Let me pass over to you, Jamie, for your welcome remarks.
Thank you very much, Blaise. And I'd like to thank everybody who's attending. I see we now have over 100 participants, which is fantastic. And thank you all very much for taking time to join this event. I'd also like to thank the partners that Blaise has just mentioned, but I think it is key that the donor community and the knowledge is shared as widely as possible. So ADB in collaboration with APRSO, GRSP, IRAP, but also TRL and TAC in terms of putting on today's event. I think if any good is coming out of our current situation and wherever we may be working is that we can connect much easier or more readily than we may have done in the past. I don't think there's any substitute for face-to-face discussions, but at least we can make the most of our current environment to ensure that we continue to learn, we continue to share experiences to try and ensure that we see a better world emerging after the pandemic. So I do thank you all very much for joining this. I hope you find it useful. And again, as was outlined, this is one of 3 modules and we have 5 sessions within this one. And I think that just highlights the importance that many organizations are putting on road safety. It is an enormous issue. It's an economic cost issue. It's obviously a social issue, and it can have a huge impact, not just on the number of fatalities, but on those with serious injuries. And so that is really just raising the awareness of the types of support that is required, and more importantly, perhaps, the actions that can be taken. And I hope today, and for the rest of this program and the rest of the modules, we can demonstrate that there is an integrated approach required, definitely in terms of the safe system, which we'll hear about later today, but also how the data, and that's one of the prime objectives of the Asia Pacific Road Safety Observatory, improving data so we can make better informed decisions, but also how that information is managed and shared amongst the various institutions. So I hope the program will provide a full overview of the coordinated approach required to address road safety. I always say this, but I'll say it again, that the key purpose of all of these events is to make sure we actually take action and we see people's lives being saved on the roads or the injuries being prevented. So thank you all very much for attending, and I'll pass it back to you, Blaise. Thank you.
Thank you, Jamie, and of course, completely echo those sentiments. Absolutely the reason that we are here, and of course, wanting to ensure that we deliver these programs to you. I'm aware that some may have joined a session that we jointly ran through the Asia Pacific Road Safety Observatory last year, and if so, we were so glad to have you there. This will really build upon that particular course and introduce new ideas, new concepts, but really specifically, and to Jamie's point, those practical steps and practical training to actually take some of the best practice concepts and evidence and put it into practice. Because as Jamie mentioned, that is really the thing that will ensure that we can work to save as many lives as possible in our wonderful region. Okay, so thanks again, Jamie. With that, then I'm going to pass over now to Dave Cliff, who's the Chief Executive Officer of the Global Road Safety Partnership. And Dave's going to also deliver just a few welcome remarks. Dave, I'll hand over to you.
Great, thanks very much, Blaise, and a warm welcome to all of you across the Asia Pacific region. I just want to provide an overview of the Global Road Safety Partnership, who we are, where we came from, and how we came to be involved in road safety. Blaise, can you just confirm for me how this screen sharing issue is looking?
You just want to start your slideshow, and then I can let you know.
Okay, I think we have the same problem as last time, unfortunately. There we go.
Yep, that looks great.
Okay, so it's important, I think, to understand who we are, our background, where we came from. So the Global Road Safety Partnership is a program within the International Federation of Red Cross and Red Crescent Societies. We're based here in Geneva, in Switzerland, and we were founded as a result of the Red Cross's World Disasters Report from 1998. Each year there's a themed report which looks at global issues of humanitarian concern. And in 1998, the Red Cross identified road trauma, road crashes and serious injuries as a man-made humanitarian crisis. That's the first time globally where it was really highlighted as a significant issue. So it identified the catastrophic number of deaths and injuries and the consequences on people and their livelihoods all over the world. At the point where the problem was really focused upon the estimated number of deaths each year, and this is just the deaths, was 900,000. Now, since that time, the number has risen to over 1.4 million people losing their lives in road crashes every year. And the estimate is that there are around 50 million injuries again every year. Now, one of the points that Jamie just made about the background to the Asia Pacific Road Safety Observatory was trying to understand the true number of deaths and serious injuries that are occurring, because a huge number are not being recorded. In some countries, it's as low as 10%. So what that effectively means is every time 100 people are killed in road crashes, as few as 10 of them are being recorded. So there's a massive missing amount of data there about where they occurred, why they occurred, the demographics of victims. Now that's just the deaths. But in terms of the injuries, the reporting rates are even lower. So understanding data, understanding the contributing factors that caused those serious crashes is also part of the mandate of the observatory. So going back to our background, the Federation, the International Red Cross, the World Bank, and DFID, which is the development agency for the UK government, decided to create the Global Road Safety Partnership as a member-based organisation. The thinking behind it at that time was to bring together governments, government agencies, private sector, as well as civil society to urgently address road safety. So our vision is a world free of road crash, death and injury. Our mission is the sustainable reduction of road crash, death and injury with a focus on low and middle income countries. And our governance is provided by an elected chair and board, which are known as our executive committee. We specialise in bringing together relevant stakeholders from business, government and civil society, forming partnerships and helping them to implement good practice road safety solutions. Now, this is an important point because we know that there is an enormous amount of evidence, which Judy will be talking about very shortly, as to what works to reduce road trauma, but there's also good evidence of what doesn't work. So over the course of these modules and sessions, we want to explain what the evidence tells us about what is effective, but also highlight those things that are just proven not to work. So the three voices that we bring of civil society, of business and government all have something to bring. Civil society brings the voice of change and societal improvement. Business brings targeted setting and focused efficiency of action. And government, of course, brings the ability to enshrine efficient social change into legislation. Some of the more major programs that we operate, one is called the Big RS program, which is the Bloomberg Initiative for Global Road Safety. The first part of this program is a series of groups that we fund to advocate for improved road safety, particularly in the areas of legislation. So it's about stronger road safety laws and their implementation, focused primarily around what we call the 4 risk factors. So drink driving, speeding, safety belts and child restraints, and the use of motorcycle helmets, as well as improving vehicle safety standards, and also providing support for our grantees. The second component of this program is building the capacity of police and enforcement agencies to more effectively enforce road safety laws and to professionalise policing. And the third leg are the global road safety and the road policing leadership programs that we run jointly with Johns Hopkins University. So our program runs globally throughout Africa, Asia, in the Pacific and Latin America, and also now parts of Eastern Europe. And we fund a large number of grantees globally working in the areas that I've just spoken about. We also have the Botna Child Road Safety Challenge, which is again about the idea of evidence-based projects focused on improving safety for our most vulnerable, our children, and operating in 7 countries as listed there in the slide. Other programs that we have operating are the VIA program, which is funded by 2 large French-based corporations, Total and Michelin. Projects in Shell and others developing in Africa. Another project with Michelin and Bridgestone also running. We're also doing work with the ADB in terms of reviews, running crash investigation and reporting training in the Pacific and also in Africa, which is about developing police to more effectively investigate and report serious crashes. And also a project running jointly with the ADB that will be beginning a little later after the COVID situation resolves, looking at crash investigation and reporting and how we can improve that in parts of Asia and the Pacific. So that's a brief background to what we're doing. And again, just to echo what Blaise has talked about, this is very much about the practical issues that you'll be dealing with and how we improve road safety. Thanks very much, and back to you, Blaise.
Thank you very much for that, Dave, for that welcome and that introduction to the GRSP, and again, a warm welcome to all of our participants to this course and this particular module focusing on road safety management, which, as I mentioned, is the first key pillar of action on road safety for the decade of action on road safety. And as I mentioned at the top, we'll be having many sessions, quite a few sessions of this particular module, really focusing on road safety management, the practical skills and application of those skills, and of course, our homework assignment, which you should have seen hopefully in your agenda. But we thought it was important to place that within a context and to I guess, provide you both, I guess, an update in terms of where we currently sit in relation to road safety globally and regionally. And then also, Jamie mentioned right at the top there about the safe system approach, which is the globally recognized approach to addressing road crash, death, and serious injury, of which road safety management is a key aspect. So to do that, we're going to have our first, I guess, formal presentation for this particular course, and that will be delivered by Dr. Judy Flyder from the Global Road Safety Partnership, who hopefully you've seen just pop up on your screen. I will just again provide quickly a reminder that if any participant during the course of Judy's presentation would like to make any comments or share or ask any questions, please just utilize the Q&A function in your Zoom platform, and we will try to get to as many of your comments or questions during the course of the session. Okay, with that, I'm going to pass over to Judy.
Thank you very much, Blaise, and I add my greetings. Good morning, good afternoon, and good evening, everybody. A pleasure to be with you. Just also checking Blaise on screen sharing. How's that looking?
That's looking good.
Great, excellent. So as Blaise mentioned, there's quite a bit of practical content in these series of webinars that we have planned for you, but today is probably the least practical of all. And that's because we just would like to give some information about the status of road safety generally and talk about some specific issues, particularly the safe system approach, as has already been mentioned. So we're together for just over 1 more hour. We'll be taking a 5-minute break at some point in the next hour. Quite a bit of this information I may cover quite briefly, and I'm doing that just because the slides that you will have already received for today's webinar have links where you can actually access a lot of the material yourself. It's quite a dense presentation in terms of resourcing and materials. So if you may be very familiar with some or all of the reference material in today's presentation, wonderful if you are. If not, there's, as I mentioned, web links where you can go and access the material. Much of it is available in multiple languages, so you can take your time over the coming weeks to familiarize yourself with the information. But for now, just trying to progress the slide. There we are. I would like you just to think about a very specific time period, 24 seconds. The time in these days of global pandemic that it takes you to wash your hands and dry them before you move on to your next task. And the reason that we highlight the time period of 24 seconds is that that's the estimated average time between deaths, a road fatality somewhere in the world, every day. Every 24 seconds, the time it takes you to wash your hands, someone loses their life on our roads. And so I like to start with that image because it's a stark and terrifying one, actually, about what's happening to humanity every 24 seconds. So let's keep that as a reference point in our minds. So here's briefly the outline for the next hour together. A brief update on the status of global road safety, some global developments that have been and are happening around us, the strategic frameworks that have been developed to address them, and importantly, the safe system approach. So you've heard already today indications about how big a scale this problem is that we're all dealing with. And you can see there on the screen the estimates from the year 2000, the estimates from the World Health Organization from 2016, which was the data used for the last global status report produced by the World Health Organization, 1.35 million deaths at least. And you've heard Dave Cliff earlier in this session describe the estimates of approximately 1.4 million. So the numbers are changing all the time as our world is changing and our roads and road use is changing. There's the image from the global status report where you can see the key messages that are depicted. And what that last status report told us was that although the overall number of deaths of citizens was higher than the previous report, the rate of deaths per 100,000 population had actually stabilized. So what that means is there was a glimmer of good news in that last global status report, in that things were not perhaps as bad as they could have been had interventions not been put in place. And so Dave has already mentioned there are, you know, we know a lot about the things that can and do work if they're implemented well. And we also know about things that don't necessarily make a difference. So we will be canvassing quite a few of them in the coming days together. Sadly, road traffic injuries were identified as the 8th leading cause of death now in the last status report, killing more people on the road than the diseases you can see there listed on the screen. And you've already heard the staggering figure, 50 million people at least every year who suffer life-changing injuries as a result of road trauma. And we know that there are great differences actually in the way that trauma is experienced across the world. You may be very familiar with these graphs already from the status report, but here you can see distributions according to a number of things. So firstly, the first circle, the first pie chart is the population of the world split into high income, middle income and low income countries, according to the color coding. The second circle is where road deaths are distributed across those 3 types of countries. And the third one is the proportion of vehicles that exist, motorized vehicles, in the country. So you can see that there's quite a bit of discrepancy there about where deaths are occurring. 80% reported as occurring in middle income countries, that middle sector. And unfortunately, the vehicle distribution doesn't match the fatality distribution. You can see there written on the slide that 93% of road traffic deaths are experienced in low and middle income countries, but they don't have that higher proportion, that same level of motorized vehicles. So I'm going to invite you to respond to a question now. Our first poll, we've got 2 questions for you today to respond to, so please get ready. Blaise, if you wouldn't mind launching the poll question, please. So the question for you is, which region of the world has the highest deaths per 100,000 people? This relates specifically to deaths on the road, so road fatalities. And the data for the answer to this question is from the last global status report. So it's 2016 data we're referring to. Which region of the world? Is it A, the Americas, B, Southeast Asia, or C, Africa? If you would please select A, B, or C. Which region has the highest deaths per 100,000 people?
Okay, I'm just going to give another 30 seconds or so for people to answer their duty, and also again just a reminder to utilize the Q&A function if you have any questions or comments. And I just wanted to reinforce as well Judy's point that all of these materials really have been designed for you to take them off after this course and use, and with much more information and links. So please ensure to access those and use them moving forward in your work. I'm going to give another 15 seconds.
Thanks, Blaise. And I feel like apologising actually to people who are familiar with some of these resources, but actually if you're like me, I love being reminded of resources that I may have heard about a year or so ago, but had kind of forgotten or put to the back of my mind. So I'm hoping that if you are familiar with the resources we're sharing today, perhaps it's a good prompt for you to go back and have a look at them to support your daily work. Thanks, Blaise. Okay, so I can see the results there. I hope you can as well. So we've got a large proportion of people who've chosen the Southeast Asian region. Fewer have chosen Africa, and then a handful of you have also selected the Americas. And so let me just let you know that the actual response is Africa. So congratulations to people who rightly selected the African region. This chart also comes from the World Health Organization status report, and the two coloured bars actually track the trend of data from 2013 to the 2016 data collection, although it hasn't changed the shape of the distribution very much. So the global average is 18.2 per 100,000 people. And sadly, our African colleagues experience a rate much higher than that, 26.6 people per 100,000. Southeast Asia is second in that list, and Western Pacific is at 16.9. I think the lowest region you can see there on the chart is Europe. And so our African colleagues are struggling with the largest proportion of traffic fatalities. This chart also comes from the status report, and I apologise for the busyness. There's lots of numbers and lots of colours to read. I don't need you to read them all. The point of this graph is just to highlight that this is the breakdown of different types of road users that are killed each year on the road. And the point I want to highlight for the Southeast Asian region is you can see the yellow proportion of that circle. It reads 43%, and that yellow proportion is motorized 2- and 3-wheelers. And so immediately looking at this chart, every time I see this chart, I'm reminded that the issue of managing our powered 2- and 3-wheelers is an important issue everywhere, but it's really a pronounced issue for Southeast Asia, because that group experienced the greatest number of deaths in the Southeast Asian region. So something for us to keep in mind.
Judy, do you mind just, sorry, Judy, do you mind just briefly outlining, what that category and what some of the different options are in that motorised 2- and 3-wheeler category, just briefly?
When you say options, Blaise, you mean what types of vehicles?
Correct. Yeah, we were referring to with that particular terminology.
Yeah, sure. And I know that the configuration of vehicles is slightly different across different regions, but we're talking about high and low powered motorcycles, scooters, e-bikes. They're called many different things in many different countries. And then the 3-wheelers, tuk-tuks, rickshaws, etc., etc. So it's anything that's powered, so not a bicycle, and also not an electric bicycle. But the variations of names are quite distinct in different regions of the country. But the proportion in Southeast Asia is, I think, the important point. So yes, they go by many names and configurations, but some are very highly powered, so high-powered road, performance motorcycles, right through to very low-powered, low-speed limited e-bikes, let's say, or e-scooters. Thanks for the question. So a question for you to think about, you don't need to respond to this necessarily, but a question is, why do these differences exist? Why do we see such variation around the world when our governments have been charged with the responsibility of implementing pretty much the same kinds of countermeasures, the interventions that we know will and can make a difference? And there are some obvious disparities in terms of financial and human resourcing and capacity, different, environmental climates, different kinds of vehicles and vehicle standards, different road user behaviours, different levels of enforcement. There are many reasons, but I just wanted to prompt you to think about, in your country, in your city, in your rural area, what makes the difference to why things are so different to perhaps if you're in a rural area of your country, what is it that makes a difference between how road fatalities and injuries are experienced in rural parts of your country compared to more urban and metropolitan parts of your country? And then why are they different across countries and why are they different across regions? So just have a think about that for your own purposes. No need to respond to that, although you're welcome to type a response into the Q&A if you wish, but don't feel that you need to. It's just a prompt question for you to be thinking about. So here's one of the resources that may be useful for you just to get a fuller understanding of what's happening in your country and why, and then to compare your country within region and also to other parts of the world. You may already be familiar with this, but it's a digitalized format of the last status report. This is the first time that our World Health Organization colleagues were able to provide a digital version of the report. It's not just the report, it's information where you can track trends that have happened. So you can go to your country's page, for example, and you can see what's happened across time for every time period that your country has contributed to the data collection for the World Health Organization. So there's introductory videos if you're not familiar with it. So there's some access links there for you to go and have a look, and I encourage you to use it. It's a very handy tool to be able to access numbers, figures and resources and trends. Importantly, the trends of what's been happening over time very quickly and conveniently. So I wanted to spend just a little bit of time now talking about almost how we got to where we are today. So throughout the 1970s, countries were starting to realise that things, are bad and need to change. Not all countries recognised that at the same time or with the same momentum, but we did see some quite different shifts in the way things were being dealt with. So a more evidence-based and scientific approach started to be applied to this area. More policies and laws were being developed that were able to draw upon that scientific literature. We saw more intensive policing efforts, more mass media campaigns, public awareness, so trying to raise the issue to a level of consciousness among members of the community, and more strategies being developed, so a greater level of coordination within countries. And as a result, we also saw something very, very important, increased effort on research, monitoring and evaluation. And really what we know today about what works to help improve the situation, we have the people back in the 1970s, 80s and 90s to thank for that, because when they implemented changes and they weren't sure what worked, we know what works now because of the work that they did. And so I can't emphasize enough how important it is for you to assess, to monitor and evaluate what you do when you make a difference, when you commence a new project or a new intervention, to actually check, because if we don't check, then we don't know that it's making a positive difference. And one of the worst things that can happen is we spend time, money and effort on an intervention and then we fail to measure it, because on occasions an intervention has actually been shown to create a worse effect rather than a better effect. And if we don't ever measure, then we don't know what effect we're getting. And so I always like to stress the monitoring and evaluation point. We also saw more professionalisation, and we're still seeing that across the road safety field, and people paying attention to the fact that our world was rapidly motorising. It still is. We started to see some new strategic thinking and directions in the 1990s, and I'll talk a little bit more about them, and particularly about safe system approach today. And then we moved to our new century. What did we see? We saw global recognition really for the first time. You heard Dave Cliff mention the World Disasters Report that really flagged the humanitarian nature of the drama and crisis that is unfolding on the world's roads. We saw the establishment of the United Nations Road Safety Collaboration, and some of your organisations or countries may be members of that. We've seen ministerial conferences, reporting, momentum around one particular week in the year, so UN Road Safety Weeks. We've seen multiple resolutions from the United Nations on improving road safety. In very recent years, we've seen the United Nations establish a road safety fund to fund projects at quite a large scale to help improve safety performance. And something I'll talk a little bit more about shortly, we saw the topic of road safety and mobility included in the International Development Agenda for the first time by inclusion in the Sustainable Development Goals. There are some kind of overlaying things that are happening along the way in the 21st century, as I mentioned, increasing motorization, more technology in our hands. I'm sure most of you are sitting beside some device at the moment, and the availability of devices and technology influences, I think, in a positive and a negative way, how we use our road community. And the issue of vehicle automation and cooperative intelligent transport systems. The whole technology issue is and has been developing for the betterment of safety. We just really don't fully understand the implications of that, I think, yet. And then, as I mentioned, with the inclusion in the Sustainable Development Goals, we've seen an alignment of disciplines come together. Mobility, active transport, sustainable transport, those agendas are merging, whereas previously there was kind of some siloed thinking, people working in one area or the other, but increasingly we're seeing thinking across those different areas coming together. And importantly, a growing concern for our environment, not just our built environment, but our air and waterways as well, with the development of, with ever increasing motorization and the need, the desire, I should say, to build more roads. We've seen improved reporting, and that's great. One of the trends that we have also been seeing in recent years is that the trend is going in the wrong direction in some of the what used to be high-performing, high-income countries. So that's something that has come to the attention of governments in a number of high-income countries, that they need to do more because they were going in the right direction and suddenly the fatalities are increasing. So we were fortunate to have 10 years of action declared back in 2011. We've now come to the end of the first decade of action for global road safety, the United Nations Decade of Action. And I hope that you are all familiar with what the structure was, the global plan and the 5 pillars. You can see the 5 key pillars listed there. I hope that you're very familiar with all of them. And in this webinar series over the next 6 to 8 months, we'll be tackling 3 of them. Pillar 1, road safety management, which is what we're talking about in this first module. Safer road users, which is pillar 4, and safer infrastructure, pillar 2, safer roads. And, as we were approaching 2019, 2020, the end of that decade, people were wondering what was going to come next. We hadn't seen as much improvement as the global community had hoped for. But fortunately, we were able to secure, meaning the global community, has been able to look forward to increasing impetus because of a second decade of action. So the United Nations has proclaimed the second decade of action starting this year and ending in 2030, with quite an ambitious goal to reduce deaths and injuries by at least 50%. That's a lot. We have our work cut out for us, ladies and gentlemen. And so there will be a plan, another global plan will be presented at the UN General Assembly, I believe later this year. So it's currently being developed and we await the structure and layout of the plan. In the meantime, though, we should be carrying on with the interventions that we know work in road safety to improve road safety while we're waiting for direction from the global plan. So I mentioned a little while ago the Sustainable Development Goals. I'm sure you're very familiar with them. There are 17. They're linked. They don't stand as separate issues. And it really was seen as an urgent call for action for all countries to come together and work collectively across these key areas. I hope you're familiar with them. If you're not, feel welcome to visit the World Health Organization site to learn more about the goals. But here is the the overarching aim, I guess you can see there. And I've highlighted in red the areas of that statement that I think are the most important things. We're talking about people's health, education, the level of inequality in our world, which appears to be just getting greater and greater. We're talking about economic growth, and importantly, all of those things while tackling climate change. And so I mentioned that for the first time, road safety was directly listed as an area to be focused upon in the international agenda. So there are 2 specific goals of the 17 that received attention or notification that road safety has a place to play or a role to play. And so here you can see that the intention is to halve the number of global deaths and injuries that are caused by road traffic accidents. That sits within goal 3, which is related to good health and well-being. And then it's also mentioned in goal 11, which relates to sustainable cities and communities. And you can see there again, I've highlighted in red the areas for attention most specifically. So actually I've failed to highlight in red. There's another important aspect there, and that's expanding public transport. The transport options and mobility options for our communities, particularly in our densely populated city areas, are really important. But improving road safety for all, and this goal particularly spells out people that are vulnerable, in very vulnerable situations. We'll be talking more about that, especially in our next module where we focus on safe road users. How is this relevant to your work? Well, I'm hoping that you already have an answer to that question in your mind, because the Sustainable Development Goals are meant to really drive everything that we do. But I wanted to ask you more specifically just to think about, how do all of the 17 goals, perhaps not all of them, but how do more than just goal 3 and goal 11, how does your work link to some of the other development agenda goals? And so I'll phrase that another way. How can road safety issues, how can improvements in road safety help us attain some of the other sustainable development goals as well? Because remember, these are described as 17 interlinked goals. They're not meant to be standalone in isolation. They're linked. So improving one could be able to help improve another. So here's some suggestions that come to my mind when I think about how does improved road safety benefit other areas of our society and therefore other goals. So you can see in the middle here that the topic is improving road safety. And I've listed some of the other goals that I think may also be improved by doing that. There are possibly others, but the ones of note here particularly relate to levels of poverty in our community. And so by improving, access to safe and sustainable transport, we can help bring people out of poverty, allowing them access to better education, more work opportunities, etc. But also, as I'm sure you're familiar with, often when someone is killed in a road traffic crash, sometimes it's the person who is the one who brings income into the family. And when that person is either killed or seriously injured and is no longer able to be the breadwinner for that family, the cycle of poverty can start. And so at GRSP, we see a direct link between improved road safety outcomes and improving the lives of people living below the poverty line currently. I mentioned education there also as better access to education. Gender equality is another one. Decent work environments and economic growth is another. I'm just going around the list here. Industry, innovation and infrastructure. Clearly there's links to safer infrastructure and safer outcomes on the road. Reduced inequalities and climate action and life on the land are all other areas of the international development agenda that we see linked to good action in road safety. So I encourage you to think about, when you're implementing a program or thinking about implementing a program, if you don't already think about it, then how can the work that you do help improve areas of work from some of the other sustainable development goals.
Judy, sorry, Judy, just interrupting briefly, just to maybe suggest we probably have about 35 minutes or so left. So probably time for a break sooner rather than later when you're ready.
Yep, sure. Thank you. I think it's coming up in the next couple of slides. Thank you for that prompt. So here is, I've put a link here as well. Here's one way that GRSP tries to get the message out about different ways of government investment that are needed. I'm not going to read it all to you now. It was something that Dave Cliff, our CEO, who you've just heard from, published. So feel free to go and have a look at that one-page document that we published last year, encouraging governments to continue to fund road safety. And so I'm referring you here to a document that describes, GDP per capita income growth and the changes or improvements that can come from improving road safety. So this is a global road safety facility document from the World Bank. If you're not familiar with it, I strongly recommend that you go and have a look at it, because it provides a lot of it quantifies really in economic terms, the benefits that can come from improving safety on the road. And here I'm going to just describe very briefly, there have been some performance targets, some voluntary performance targets that have been set at the global level by the United Nations, with all member states having agreed to them. And so they fall here across the 5 pillars of action. I'm sorry that the text is very small. You're not meant to have a look at them now, and I'm not going to read them all out, but there's a link there at the bottom as to the targets that the global community should be aiming for if we have a hope of reaching the 50% reduction. And GRSP was proud to be part of a collaboration last year to put together a document to guide member states on how they might be able to address and take action on each of those 12 voluntary performance targets. So I will leave you to have a look at that document in your own time if you haven't already. And there we are, Blaze. There's our 5-minute break. So folks, while you're on your break and as you're coming back from it, we would like to encourage you, please, to think about this question and to type a brief answer into the Q&A box. What are the barriers to collecting good quality crash data? And the reason we're asking that is on Thursday this week, you're going to be having a presentation from our colleagues at TRL, as has already been mentioned, about using data to improve road safety. And they're interested to know from you in advance what you see as the main barriers you experience. So during your break or as you're coming back from the break, would you mind taking a moment to jot a couple of thoughts into the chat, into the Q&A box? I'll stop there for the break and see you in 5 minutes. Thanks, everyone.
Thanks, Judy. So just to reiterate, if you can consider that question on the screen, what are the barriers to collecting good quality crash data in your country? Put a answer into the Q&A in your Zoom platform. Of course, feel free to put other questions. I know we have questions already, and we'll come to those a little later in the session. I have 5:28 on my clock, so that would be 3:28 Manila time. So that means we'll come back at 33 minutes past the hour for the break. So 33 minutes past, and we'll see you then. Thank you.
Okay, shall we recommence?
Yes, Judy, we just can't see you at the moment.
But you can now.
Yes, we can. Good. So I might just quickly update you. We have had some good feedback already to the question on the screen today, and please, participants, do feel free to continue to type in. So, Pasindu has mentioned that the police are in charge of crash data collection, and there isn't sufficient training to identify the causal factors and then record those attributes. Sonam has mentioned lack of recording data at the time of occurrence, and also lack of ability of the individuals who record that data. Sidikala has mentioned the lack of a centralized electronic data collection system. Krishna has mentioned problems in relation to integrated network, and also lack of standardized formats. Data security has been mentioned. Training and also interagency coordination. Prem had mentioned that one. So many coming through, and please continue to bring them through, as well as any questions or comments on Judy's presentation.
Great, thank you, and thanks everyone. We appreciate your comments and thoughts, and we shall be passing that on to our TRL colleagues who will be joining us on Thursday this week. So we have about 25 minutes left together, so I'm going to continue on talking about strategic frameworks. So time for our second poll question, please, Blaze. Should be.
So sorry, I'm actually going to have to ask our ADB team to do that, because I don't have the functionality here, I believe. So I'll just ask Michelle or Diane to run the second poll question.
Thank you. Thank you to all the people who make this webinar possible.
I think it's visible to our host. It's on.
Sorry, I missed that. Was that Michelle?
Connie is the host now. Oh, and this is Diane. And I think Connie is the host now.
There it is. Thank you very much. Hope you can see that, everyone. The question is true or false. If everyone obeyed the road rules all of the time, would there be no more, there would be no more road crashes. I'll read that again. If everyone obeyed the road rules all the time, there would be no more road crashes. True or false? If we had a fully compliant population with all of our road traffic laws, if we all obeyed the road rules all the time, there would be no more crashes. True or false?
Okay, so while people are responding to that, Judy, a few more answers to the question around data collection. So training has been mentioned again by Mr. Bebinsala. Mohammed Kaisar has mentioned lack of funding allocation, but also no monitoring of the regular updates of data. There's been mention here of having lack of national electronic data collection systems. Again, we've also got mention here from Sonam around lack of training, as well as the environmental factors. Ahmed has mentioned the high government officials are not interested in making these policies, but also that there's weak interest. And Watiela has mentioned again about the fact that the police data that comes through doesn't really reflect the information that would be required.
Thanks very much, everyone. Some serious issues outlined there.
Okay, I'm going to end the polling there, Judy, and I will share the results.
All righty, thank you. So the majority of you said false, but about 1 in 5, by the look of it, think that statement's true. So if everybody obeyed the rules all the time, there would be no more crashes. So my response as a road safety practitioner is false. That's the way I see the question. And I'm going to explain why. So let me just continue to click through. And that is because people make mistakes. And the reason that's important to this presentation today is because that's linked directly to the concept of the safe system approach. One of the primary principles that we recognise under safe system thinking is we're human, we're frail, and we are prone to making error. So even if something happens on the road and we're all obeying the rules, road user behaviour is not the only cause of why things go wrong when we're using the road. And so if we have a fully compliant population, we make mistakes or somebody else does, and so ultimately a crash may still occur. So that's the primary issue. The secondary issue is that behaviour change is not an easy thing to create. I'm sure you know that from your own personal lives, particularly if you're parents. Trying to change the behaviour of our loved ones or ourselves is not something that happens very easily. And so this also links to the concept of the safe system, because historically what's happened is the majority of the blame, let's say, has been placed on us, the people, we the people who use the road network. And what that's done is delayed over time recognition and attention on the other parts of our road network, our roads and roadside infrastructure, the vehicles that use our roads, and the post-crash response, things that happen to help preserve life once a crash occurs. So this idea of blaming the people has been very present in our road safety interventions in the past, and we want to move away from that. And so a strategic framework can help guide our thinking in that area. And here are a range of other things that a strategic framework can do. It can help address the many competing interests that we face as road safety planners and practitioners. It can help articulate a vision, and an obvious one in that example is, in that line, is the example from Sweden, which is Vision Zero. I'm sure you're well aware of it, where the Swedish government decided that any death was unacceptable. And so from a philosophical point of view, they adopted the idea of zero fatalities, hence the name Vision Zero. The strategic framework can also help identify goals for your work, a foundation of principles, and importantly, it can help identify areas of accountability. So it's one thing to have a plan and a vision. It's another important aspect to identify who and which organisations are going to be accountable for that action.
Judy, just before you move on, a couple of comments based on that poll, which I think reflect what you were mentioning there. Prem had mentioned that even if all road users obey traffic rules at all times, there can still be crashes due to failures in relation to the vehicle, but also road conditions. And City Colour had mentioned that it was false, and that was because there are some elements that are out of control of drivers, again, such as issues to do with vehicles themselves.
Yes, thanks everybody. I appreciate those comments. Thank you, Blaise. And so I'll just, moving on, but sticking in the similar line. So here you can see the three probably most well-recognised frameworks, and we're going to focus today on the safe system approach, as it's been the one that's been adopted, let's say, by the global plan and the global road safety community. And that is the safe system approach, which has a lot of overlap actually with things like Vision Zero and sustainable safety. But as I mentioned, it's the one that the global community has chosen to adopt. So I hope you're familiar with it, but even if you are, I'm going to take some time to describe it in a little more detail perhaps, and to describe the way that we at GRSP and other colleagues in the global community think about it. And to do that, I'd like to ask you to please stand up if that's comfortable for you. I'd like you to stand just for a minute or so while I ask you to imagine a scenario. So please stretch as you're standing. You've probably been sitting at a desk or a table or at a computer for quite a while now today. So please stand. And I'd like you to imagine that you're standing either, the picture on the left of the screen is from a ship, a cruise ship, I think. Not in service, I would guess right now, but I want you to imagine you're standing either on that balcony of that cruise ship or on the top floor of that apartment picture that's listed there, that's photographed there. And this exercise was described to me some years ago by our colleague from IRAP, Greg Smith, who you'll meet in coming webinars as well as part of this delivery of this course. Greg used this thought exercise, which I love, because it helps us think about the way other parts of system design have embraced concepts of the safe system. So I want you to imagine, you can close your eyes if you like, I want you to imagine that you're standing on one of those balconies. And now I want you to imagine that the safety rail and the safety glass is missing. So there's nothing to protect you. It's just the platform between you and the ocean, or between you and the ground, depending on which balcony you're standing on. And the reason that I like these pictures to demonstrate safe system is people who designed these two things inherently understand the idea of a safe system. They recognize that human beings will make a mistake. And they recognize that our body is frail, and that if we make that mistake and step over the edge, something bad is likely to happen to our body, because we can only withstand so much force before we sustain a serious or fatal injury. And so the idea here is that if you were standing on a balcony with none of those safety features, what would you do? Let's say you'd consumed too much alcohol. Are you really going to pay attention to the sign that might be on the wall that says, if you've been drinking too much, don't walk close to the edge, you might fall over? If you've been drinking too much, are you likely to take any notice of that sign? Let's say that you've got a 2-year-old child who's wandering around the balcony. They can't read the sign. Let's say their teddy bear gets pushed over the end, or a ball gets kicked over the end of the balcony. What is that child's response going to be? They're going to follow that toy. They don't have the skills to know that that's dangerous. And if you're not there to stop them, then they're going to go over the edge and be harmed. And so the idea of the safe system here is that the designers of these buildings and boats have recognized that humans make errors. We're not always fully appreciative of what the risks are that we face. And so they've created a system that stops us being harmed. You may sit down again if you wish, or feel free to remain standing. So the main principles, as I mentioned, is we make mistakes and our body has physical limits. And so the aim of the safe system is to ensure that if and when we make those mistakes, or somebody else does, that doesn't result in a death or an injury. So the goal is to create a transport system that is much more human-proof than the ones that we've built around the world up until now. And another guiding principle of this system, the safe system approach, is that this is not just the responsibility of me, the pedestrian, or you, the taxi driver, or you, the government designer, you, the police officer. It's actually everyone's responsibility within the system. And so here's where there's been many diagrams created to depict the safe system approach. Here's the GRSP version of that, but essentially they all say the same things. There's those 4 key components of safe roads, safe speeds, safe people, and safe vehicles. But the issue in the center is the critical one. We are frail individuals. Our bodies can only withstand so much. And when things collide at speed, our body can't cope with the forces that come from that impact, whether that's, truck to car, car to motorbike, motorbike to person, motorbike to motorbike. It doesn't matter. Our bodies can only withstand so much force before injury occurs. And so here's another way of thinking about it. Here are the 4 main areas: roads, people, vehicles, and speeds. And so these boxes are to indicate what we want to happen. We want roads that are more forgiving when we make an error, and we want people who are alert when they're using the road and compliant with road rules. We want vehicles that can help avoid a collision or protect us if we are involved in a collision, and we want speeds that are survivable, that are allowing for our human tolerance. And what that leads to is this concept of having safe interactions as we move around our road network. Another resource, that's the link here at the bottom of the screen, is describing the way that safe system thinking is different to the way we've traditionally thought about some key problems. And so in the red box on one side, what is the problem? What are the causes? Who has ultimate responsibility? What is the major planning approach? And what is the appropriate goal? And then the next column describes how we have traditionally thought about that. And the end column describes that differently under a safe system approach. So just as an example, traditional thinking, what is the problem? The traditional way of answering that question was that crashes are the problem. But in the safe system approach, we talk about the outcome of that, the fatalities and serious injuries that happen because human tolerance to forces, to impact, is at the center of the safe system approach. And so just running down the list there, if you look at the third one, who is ultimately responsible? The traditional thinking was, we are, the people, the road users. Let's blame the people that, it's your fault for driving while tired. It's your fault for stepping out in front of a vehicle and you weren't looking. But actually in the safe system approach, who's ultimately responsible? The people who design, but I would add actually the people who use the system. We're all responsible. So if you want to learn more about that or read up it if you have already seen it before, please visit the Towards Zero Foundation website. You'll see that laid out quite nicely. A couple of other resources, I won't go through them in detail now, but there's a link here to the Safer Journeys website, which is the New Zealand government site that leads you to this video. It's freely available on YouTube. It's quite a lengthy one. It's about 20 minutes, but there is a much shorter version as well. And it talks you through a crash in a rural part of New Zealand where someone is killed and someone is seriously injured. And it also describes under a safe system approach how the circumstances leading to that crash may be very different. So I encourage you to watch that because it describes the system and the changes quite well.
Judy, about 10 minutes left.
Thank you, Blaise. I'm almost there. And then a couple of other publications. So here is one from our colleagues from the World Resources Institute and the Global Road Safety Facility. They've published something called Sustainable and Safe, a vision and guidance for zero road deaths. So I've listed here some of the key aims of the document. So it describes the principles, it discusses opportunities for the application of safe system approach in low and middle income countries, which is why we're mentioning it here today. So if you're not already familiar with that, please click on the link and access that. It's a very useful document, creating some steps that your policymakers can take to create a plan that's based on the safe system approach. And here's 4 of the key findings from that document. So I encourage you to have a look at that and to use some of the guidance in that to perhaps for your homework activity throughout this course, but more importantly for your daily work. And then finally, a resource also to finish from the World Bank and others under the Global Road Safety Facility badging. This was launched a couple of years ago, and it goes through and describes opportunities and challenges in the low and middle income country context. So it's a guide for people working in those countries, and it actually gives some snapshots of each of the countries, looking at the key metrics that are available already to be used in planning and monitoring. So there's a link there. It's freely available in multiple languages. And I'm just going to finish by describing and just giving you some screenshots of what you can find in that document if you aren't already familiar with it. So it provides information across each of the 5 pillar areas from the first decade of action. It gives a status update for each country, and it talks about or identifies the key risk factors, issues and opportunities to be addressed. So a very useful document. I strongly encourage you to have a look at it. And so finally, here's just some screenshots from one of the countries in our region. This is from Mongolia. A very busy slide. I don't expect you to be able to read all of that, but just to give you a sense, this first slide looks at the scale of the challenge faced in every country. And then there are pages that cover each of the different pillars. So here you can see there's information for Mongolia related to Pillar 1 and to Pillar 2, so covering road safety management and safer roads. So it talks about whether there's been audits done, whether there are national strategies, etc. Then there are also moving on to Pillar 3 and Pillar 4 that covers safe speeds, safer vehicles. So you can see the different, in a snapshot, it's a really useful way to find out information about a particular country. And then here's something about safer road users, post-crash care as well. So a nice way to find useful information all in one place, already categorized for particular countries. So I'd like to end the presentation today just by thanking you, first of all, for your attention. And a reminder, we've spent a lot more than 24 seconds together today. But for every 24 seconds that has rolled by during our webinar time together, another person has lost their life every 24 seconds. And so I just bring your thinking back to that to emphasize the urgency of, needing to address this humanitarian crisis that is the number of people that we're killing and seriously injuring as we move about our world every day. And a reminder that, you can make a difference. Your decisions and actions can help protect everyone as they use the road network in your country. And so we hope that today's webinar is just the start of our time together to provide more practical approaches. As I mentioned, today's really quite a theoretical presentation. We'll be moving together into the more practical sessions in the coming days and weeks. So thank you for your attention, everybody. Greatly appreciated. And back to you, Blaise.
Thanks, Judy. And I might just suggest that you actually stay online, and I'm actually going to invite Dave Cliff back as well, just so we can run through a couple of questions that have come through the Q&A from today's session. Judy, I wanted to start two for you, and perhaps the first one you've touched on, but good to kind of reiterate or to perhaps provide an example again. So Elias Shah had asked what the reason is. Some of the reasons are specifically for more deaths in low middle income countries, depending on others. We're actually particularly looking at middle income countries as well. So maybe there might be something there around, the rapid motorization that you mentioned. But yeah, again, good to hear more of your thoughts on that. And Sonam had asked whether you might be able to explain how improved road safety can ensure better gender equality as well. So I might leave you to answer those, and then I'll come back quickly with a question through here for Dave.
Yes, certainly. Thank you. And thanks everyone for the questions. Greatly appreciated. I mean, I'll give a very brief answer. I'm going to start with the second question first. It's most recent in my mind. I'm reminded by that question of some work that some of our GRSP team has done in Vietnam. And we've been working with local partners there, trying to improve access for people to public transport options. And one of the issues that was raised was not just about, when we use the word road safety, often we think about safety outcomes not being harmed from the impact forces of a crash, as I've been describing. But safety also can relate to personal security. How you feel. Do you feel safe from threat other than impact force? Do you feel safe? And so particularly, this was in relation to girls and young women accessing public transport in Vietnam. And they were feeling very personally unsafe entering public vehicles when moving about their own community. And so in terms of female participation in work or just in society more generally, improving safety outcomes through limiting exposure to impact forces, but also improving personal security can be a side benefit to improving the way people move about the community. And so certainly that's how I see one example relating to gender equality. Sorry, Blaise, the first question. Some of the factors relating to why there might be the regional disparity. I think people, even in the answers that people gave to the data question, there are some hints there to some of the factors that I would see as important. But I also think something we don't talk about a lot when we talk, because we spend a lot of time talking about some of the first 2 or 3 pillars, And we don't spend a lot of time at GRSP dealing with post-crash response, not because it's not important. Of course it's important. It's not really, the breadth of our work doesn't span into post-crash care normally. But one of the key issues, I think, is once a crash occurs, if we can't prevent a crash, how quickly can we get appropriate support, medical support, first responders, and then follow-up medical support to people to help save their life and make their injuries less severe. So I think there's a lot of work to be done in improving post-crash response. All of the other pillars are equally important, but I raised that one just because I think access, particularly for rural and remote communities in low and middle income countries, to good post-crash response is a very important issue that needs to be addressed, and helps keep that divide a very large one, particularly between rural and urban communities. Thanks, I'll stop there.
Thanks, Judy, and thanks for those questions from our participants. Dave, I wanted just to raise one with you. I know that we'll talk a little more about data and technology in relation to road safety management on Thursday, but given we had that question come up, there were a lot of participants who did raise the issue in relation to data collection about the role of the police and issues in relation to that in their countries. Not that police have that role, but some of the challenges that they face in collecting good data. And I wanted to bring one comment here from Hamid from Pakistan, which I'd ask you just to briefly respond to. So he mentioned that historically in Pakistan, road crash data is mainly maintained by police departments in their jurisdictions. And then recently rescue services are collecting information, but there's barriers that are still there related to location, the type, other relevant information. Standardization is also an issue amongst different police departments, and also training on data collection and the use of technologies is required. So as I mentioned, TRL will talk a little further to these later this week, but I thought given you were here and you mentioned earlier around some of the crash investigation and data collection work, you might like to just briefly respond to that, given it was a key element that was coming up through many of the responses.
Yep, it's a big topic. All the issues that have been outlined, they're a problem globally in many countries. So one is the training standards for police themselves on how do you comprehensively investigate a serious crash? How do you reconstruct what occurred? How do you measure pre-crash speed? All of these things require a high level of training. Location is a perennial problem. Some of the ways in which jurisdictions have got around that issue is they have electronic reporting of crashes, which, for example, can be on a mobile phone. Again, you need the technology and infrastructure to do that. I haven't got an easy one-size-fits-all response to that. All I can say is it's absolutely on the radar of the Asia-Pacific Road Safety Observatory. So standardizing data collection, ensure reporting rates are improved, accurately recording all the deaths that occur in road crashes, all the injuries and classifying them are all fundamental. So the work we will be doing with the ADB going through this process for, I think, 5 or 6 countries within the Asia-Pacific region will be one way in which we will start to catalogue the sorts of issues that are occurring and why these reporting rates aren't being recorded as well as they could. But I think that the fact that you've highlighted this issue for Pakistan is valuable. But it does really require a concerted effort, both in terms of the training of police, the method of data collection, potentially electronic collection as opposed to paper-based, the database, the way the data is coded, huge issues that do require a lot of work. Look, I could go on this, but just I'll leave it there for the moment. Back to you, Blaise.
Thanks very much, Dave and Judy, for that, and again to our participants for those questions and comments. Okay, I might just ask Michelle or Noel to bring back very briefly as we come to a close again the agenda, so I can give you a reminder of that. So as I mentioned, this is the end of our first of the webinars of this module. We'll be back at the same time on Thursday, which is 2:30 p.m. Manila time, for another 90-minute session, where we'll now take that broader framework that Judy has started with today and start to narrow it down to this particular area of focus, road safety management. So as I mentioned, Samantha Cofield from the Transport Accident Commission in Victoria will lead a session focusing on the role of lead agencies and also the development and monitoring of strategies, road safety strategies. And then TRL will actually further talk to those issues around data and technology in relation to road safety management. So that is coming up this Thursday. And then, as I mentioned, the following Monday, we'll actually have a 2-hour more practical training session where we will focus in on the skills required to set up good road safety management, and we'll also introduce your homework assignment. So with that, a big thank you for your attention today. Fantastic to have so many people enrolled in this particular capacity building program. Apologies again for our technical issues around the Russian interpretation, but we will have that sorted by next session. And again, we'll be sharing out the recording or transcript of this session to those participants. A big thanks to Judy and Jamie and also Dave for their contributions today. And I wish everyone a wonderful day or evening, and please stay safe and healthy, and look forward to seeing you back here again on Thursday. Thank you.